Good afternoon. Thank you for joining today's VaxCare discussion on flu season 2020. My name is Joe Lovelace. I head up marketing here at VaxCare, and I'm joined by our head of medical affairs, Wanda Filer, who I will formally introduce here in just a moment. Today, we're going to talk about the characteristics really surrounding the 2020 flu season and innovations that we're seeing there in the marketplace that we've built to really help practices adapt for such a time as this. So a few brief housekeeping items about today's webinar. This is going to be around a 30-minute discussion. It will be recorded and distributed to you tomorrow. There will be a Q&A at the end, so at any point during today's webinar, you can ask questions using the panel on your right. Please try and keep your questions applicable to the whole group. If you have something specific or direct that you want answered, feel free to follow up and ask us at help@vaxcare.com, and I'll share that again at the end. With that, I'm going to go ahead and jump in and introduce to you Wanda Filer. At VaxCare, I work with a lot of really smart and fun people. Wanda certainly checks both of those boxes there. She's the head of medical affairs for VaxCare. She served as the first physician general of Pennsylvania and president board chair of the American Academy of Family Physicians. She lives in York, PA, and actively sees patients at Family First Health. She serves on a lot of boards. We won't go into all of them, but what's important to understand is she spends a lot of time advocating for patient health and the tools and policies needed to help practices be successful in today's environment. So with that, Wanda, I'll hand it to you to talk about what we're seeing in the landscape today.
Great, thank you very much. Can I ask you to show your screen, please?
Yes, you can.
Thank you so much.
That's always helpful. Thank you.
There you go. Thanks so much, Joe. Well, welcome everyone. It is my pleasure to be with you this afternoon. And as Joe just told you, I am a family physician in York, Pennsylvania, and I've had the privilege of taking care of patients for probably, holy mackerel, maybe 35 years now. Right now, I see patients at a federally qualified health center, and I'm very passionate about public health and primary care and strengthening primary care. Over the years, I've traveled all over the country and spoken to thousands of my colleagues in family medicine, pediatrics, and internal medicine. And I know that primary care has had struggles. We haven't had enough resources devoted to us for a very long time, even though the national data shows that health systems that are built on a strong foundation of primary care, we get better care for patients, better outcomes in the community, and we do so at a lower cost. And so as I was running around the country talking to my colleagues, one of the things that I heard quite a bit was the concern that they're having real trouble with immunizations. They're having the sense from many practices that they're losing their shirt when it comes to immunizations. And many of my colleagues are really, embarrassed that they're either not providing immunizations, they're having to send people to the pharmacy or their local health department. And this is not the way they plan to do medical care. They want to be able to do top-notch, first quality care, and the economics of it have made it really difficult. And so when I first heard about VaxCare and they approached me, I was really intrigued because this checked so many boxes for me as a family doc, and particularly an advocate for my fellow primary care clinicians. And so I really would encourage you to, dig into VaxCare and see whether it's a solution that might be of interest to you. It's also been really interesting because VaxCare is going to do, about 1.8, that's the projection, 1.8 million doses of vaccine this year alone. And so we get a chance to see data and trends. Joe, I'm going to have you take me to the next slide, please. One of the things we know, I just co-authored an article looking at our data, and we took a look at our 2,000 plus clinics. In this particular study we looked at 1,100 plus clinics or practices, if you will, that we had in our system in 2019, and then we looked at what their immunization numbers look like, compared them again during COVID for about a 12-week time frame ending May 31st, and it is stunning. The numbers, as you and I all know, primary care almost ground to a halt in this country because of coronavirus. And that is creating major challenges for practices, for their financial viability, for their ability to continue to care for their patients. Most of us have made that very rapid transition to telehealth, but it's really tough to give a vaccine across the computer or through the telephone. And so VaxCare is here to help you figure out how you can keep your practice not only surviving, but actually thriving, doing the kind of patient care you want to do. Excuse me. So we know that as this pandemic has really rolled across the country, a lot of primary care offices are really trying to determine right now what they can do to survive. I will tell you that I am absolutely convinced now, having been at VaxCare for 18 months, that they are committed to the strength of primary care. They are committed to helping practices see an upside in their immunization program, be more financially secure as a result of working with partners with us. But our data also show that while we know there are millions of children, there are also now, the numbers were even worse in adults. When we looked at the adult vaccine rates have dropped precipitously year over year from 2019 to 2020. And some of the scariest ones were in the patients 65 plus, which are really the most vulnerable when you talk about secondary infections. Imagine if we get a bad flu season and we also have ongoing coronavirus impacts. This could be absolutely devastating for the population of this country and the patients that I take care of every day, as do you. And so we really need to work and redouble and triple our efforts to try to get people fully immunized. We know that there's going to be a huge resurgence along the way of interest in vaccine. A lot of public studies are saying that people are hesitant to come into the office, but they very much are going to make sure they get their flu vaccine because they know that that could be an absolute double whammy. Huge vulnerabilities right now also around measles. And so lots of kids and possibly even some adults are maybe very vulnerable to measles. We're here to help. We're here to help you make some decisions as a practice. We'll go to the next slide, please, Joe. This is a time for you to really decide what you can do as a practice to kind of continue to step up your game. You're probably doing telehealth and telemedicine. So there are some things that you're going to be able to do to really change the way you do healthcare, and we're here to partner with you to do that. But my goal is to ask you to really think about your immunization protocols. What do you have in the office that helps you to identify who needs some immunizations? How do you get those things accomplished? And then how do you communicate with those patients? You have an ongoing relationship with these people. I have patients I've taken care of for 30 plus years, and I know them, they know me, and when I make that recommendation as their trusted medical provider, when I make that recommendation, they are far more likely to take it. So a recommendation and communication from you about the importance of their vaccines and keeping them up to date can make all the difference and be a life-altering and life-saving decision for them. So we're going to ask you to go ahead and think about what your practice can do, how your practice can continue to communicate with these patients that you care for in so many ways. Whether it's patients that you care for across their lifespan. If you're like me, we take care of the whole age spectrum, from newborns all the way to the very senior populations. These people need to hear from us. They need to understand all of their prevention needs as well as their ongoing medical care, but focusing right now on making sure we close those gaps that have occurred over the last 12 to 14 weeks and are continuing to be a problem. We're still seeing, particularly pneumococcal vaccines have really been dropping off in the adult population. That's scary, and that puts that patient at substantial risk come this fall when we come into some really bad seasons. The Rite Aids and the CVS's and the Walmarts of the world, they have, they can give some vaccine, but they don't have that same trusted relationship with the patient that you have. And so we want to take advantage of that. Joe? So what we're going to ask you to do is use the next few months to think about some pivotal changes you can do in your office, things that you can do to continue to adapt. I actually believe that this COVID challenge to primary care positions us in a new world, and it gives us the opportunity. We know that primary care makes a huge difference to the health of this country, and we've not had enough investment in primary care. And so I would like to continue the challenge to say it's a new world for us. This is an opportunity. We can roll over and die, or we can really step up our game and show this country and our communities and that individual patient what we can do for them.
Awesome. Thank you so much, Wanda. I think we've seen across the board, to change and adapt quickly in this type of environment really takes a series of strategic partnerships to take place. Many of you made telehealth changes that you could not have done without some of the technology providers and the partnerships that were created there. And we've had many people who have reinvented their vaccine program by partnering with VaxCare that they wouldn't have been able to do in a scalable way on their own. So what I'm about to walk through here is a series of tools and kind of programs that VaxCare has built out for its existing customer base to really help address the issues that we're seeing across the board right now. And I'll give you a further insight into what VaxCare does holistically with our partners here at the end. But for this conversation, we really wanted it to focus on a primary understanding of what are we doing to help people adapt in this COVID environment that they're currently seeing. So the tools you're about to see are at no additional cost to our existing customers. These are part of the tool sets that we, again, as we talk about the word partnership, we really want to see all of our partner practices succeed. And so part of that is equipping them with the tools to adapt within the existing framework. So, from VaxCare, across the top, we've increased our 2020 allotment significantly by increasing our pre-book by more than 65% year over year. Rite Aid came out and they've increased their pre-book by 40% year over year. All of the polling data is suggesting related to what's out there from a sentiment perspective. And obviously we all know that the health risks that are at stake right now, an extreme surge that's going to be taking place. So, VaxCare provides earliest available shipping for manufacturers and also full product availability kind of across the board. So, as we think about the different roles, VaxCare is going to really help drive access points and really some tools to help from an effectiveness of workflow as well as safety for the patient and the practice. Communication standpoint, though, is still going to be in your court. And we cannot stress this enough. This is the time for your practice to lean in related to the communication to your patients like never before. There will be many people trying to communicate and try to grab their attention, but you have a seat of influence in their life, and now is the time to show up so that way they've got frequent communication that is letting them know of the importance of catch-up as well as getting their flu at such an important time as this. So if you're not already doing social media or other forms of communication, I'd encourage you to put that in the hands with anyone at your office that you think could make a good dent and can communicating consistently and clearly with your patients. But let's look at some of these tools here that VaxCare has built to really help equip practices in a unique way this flu season. The first we're going to look at is our Predictive Flu pre-book. This is how we equip practices to have the right amount of doses on hand at all time. The second we're going to look at is a Curbside Clinic Kit, and at the center of that is a hardware device that we provide to practices, again, at no additional cost, in order for them to be able to have a streamlined workflow to be able to immunize outside of the clinic. And then the second is what we call Family Flu Protect for flu and Tdap. This is a great opportunity to be able to quickly capture mom, dad, or guardian in the process of pediatric immunizations. So the first thing here is kind of our Predictive Flu pre-book. So partners of ours that come on board, we've got a whole look at their historical usage and understanding by product. And we're suggesting kind of year over year changes based on changes we're seeing in their market, region, or specialty. And we're also taking into account how is it that you're planning to shift in 2020? Are you going to be offering curbside opportunities? If so, at what intervals? All of this gets built into really a smart algorithm that makes sure that you have the right amount of doses on hand at all times. So we operate off of a par level system. And so understanding what your needs are going to be, we're able to order automatically to make sure you've got the right amount of doses on hand. And our practices that don't have to take any action in that we're monitoring their inventory the entire time and sending out shipments as it's necessary, and we monitor that for them. The second here is this Curbside Clinic Kit, and at the heart of it is the VaxCare mobile hub. So this is a hardware device. You think about a large iPhone, and then you expand it by maybe another 30%. It's a significant device that you can hold in your hand. It's LTE enabled, which means it's not using Wi-Fi or Bluetooth. We've got a data connection there that we're paying for on your behalf. And it's also a secure device that's also a pin lock security as well, to make sure there's unique identifiers to understand who's using the device at all times. What you're seeing right there in the screens that we've got is patient information that's flowing over directly from EHR. So we've got direct integrations with your EHR. So that way, as a patient gets scheduled, all of your patient scheduling shows up here on this mobile hub. And this becomes a huge workflow time saver. As you're out there, I've already talked with a lot of practices that have already started curbside type visits. And simply the difficulty is, the amount of the workflow hassle from a paper standpoint, and even handing things back and forth is really problematic. It's the opposite of the curbside speed that patients have begun to experience in the retail environment. We're trying to provide that same sort of experience in a healthcare environment that gives them the sense of access really that they've come to experience in other retail environments. So again, you've got all the information that's flowing over from the EHR. You're simply selecting the patient. The camera is going to pick up the barcode on the dose, and so it's going to pull off lot information, expiration date from that dose. It's going to automatically enter it into the system. You can confirm patient consent and then check out. The way VaxCare's process works for our customers is, simply with the selecting the patient, the scanning of that dose, we're updating their inventory from that moment. We're then automatically reordering where there represents a need. We are ensuring safety measures like ensuring the dose wasn't expired, ensuring the dose is given to someone that's in the correct age indication. And then the last element, which we'll talk about in a minute with the scan of the doses, we also bill for that dose on their behalf. So, this mobile hub that you're looking at really acts as, with a single scan of a dose, acts as really the epicenter for a whole new streamlined, secure, and safe way for you and your practice to now immunize at scale. It also has the built-in functionality that should you want to open this up to the public as well, let's say you put a sign out by the road or you schedule certain times to let the community know that you're open for immunization clinics this flu season. There's quick and easy ways to simply add a patient that isn't already in your EHR. And that process is actually as simple as clicking add patient, taking a picture of their driver's license, taking a picture of their insurance card, and then that information is automatically encrypted for you to be able to go ahead and capture all the information needed for us to be able to actually bill for that visit on your behalf and then pay you administration for that. So we see that working really well in the flu environment. The other environment we see it being extremely productive is in pediatric visits where there is a parent or guardian that is present. And we know these are the most consistently under-immunized demographics that exist out there. We know children are the most, but we know these parents are strong believers in immunization. They simply, it really is a time issue of scheduling the next appointment for themselves. They're not so much willing to do, but they want that holistic safety there for their family. So I hear a lot from our pediatric and family medicine practices, that they consistently have parents or guardians that are saying, can I also get a flu shot in this visit? You and I both know from a workflow standpoint that feels nearly impossible to then get them added to your EHR and process them. In VaxCare's workflow, all it takes is simply a picture of that driver's license, and we already have the matching insurance information on file that we've connected and integrated through your EHR to be able to go ahead and bill for that visit. So you don't have to add all these additional patients to your EHR anymore. Simply with the scan or taking a picture there of that driver's license, we're then able to bill for that on your behalf and then to make sure that you are paid for that administration. So kind of top to bottom, we know that with the changes that have happened here with COVID, going into flu, but also looking at your holistic immunization strategy here for the second half of 2020, and then whatever we're going to face in 2021, it's going to take significant adaptation. And it's going to take a series of steps that weren't required before to get full awareness out there and to adapt to create additional access points for your patients. VaxCare is really creating solutions here, this blue line, to really show up at all these important and pivotal checkpoints to make sure that you're fully supported to adapt and change. And we want to make sure that you're aware as you're considering the ways that your clinic can move or adapt in the coming environment, that you're aware of some of the tools that we've built out for our existing customer base and to find out any ways that you can also engage in those as well. So I want to address one thing here. So, what we've just talked about is really addressing the pain that's been introduced with the changes from COVID. However, anyone who's running an immunization program at all within their practice knows there's some other pain points that feel just as difficult to them today. And that's really what VaxCare does today is, we solve existing pain points for practices related to vaccine purchasing, vaccine management, and vaccine billing. What we've just gone over is the COVID complexities, that we're helping to address for our partner practices. But we already exist today in a really significant way to help along the quadrant of three things. We help practices buy, manage, and bill for their vaccines. And that simply means we buy your existing inventory that you have on hand. That's cash on hand that you can then put into your practice. I've heard from a lot of practices that, while things shut down over the last 2 to 3 months for them, that was cash on hand that was sitting in their fridge that they wish they had as working capital. From that point forward, we provide cost-free vaccines that we auto ship to them. And then from there, we help manage their entire vaccine program. We help connect the dots of all the different systems from the HR to the clearinghouse to the shipping to the billing. We connect all of these dots with a single stick scan of the vaccine, what's called our VaxCare hub that sits by the refrigerator. And this is really what will give you full measurability into your vaccine program. And anything that's visible and measurable is going to give you confidence in brand new way with the way that you're operating your vaccine program. And then the third element is we then bill for those vaccines as well. So after doing the buying and the shipping, helping you manage it, we also take the effort off all of the billing that's required for those vaccines, and we simply pay you for administration. We want to elevate the type of work you do in your practice. We want to eliminate the barriers that are experienced that prevent full immunization taking place. And we want to help really partner with your practice to a level of operational excellence when it comes to running a vaccine program for all that's needed here in 2020. So I want to open it up here to see if there was any Q&A that's come through for anyone. There's some questions here about, which EHRs do we integrate with? There's a long list of EHRs that we integrate with. So I'm afraid I can't go into specifics of each one of those, but we'd certainly love to help out with that. If you'd like that full list of EHR, I actually have your name right here and I can follow up directly, but you can also reach out to help@vaxcare.com. We can give you that full list as well. There was some questions around how our billing process works. And I think that's a good question to ask. Our billing process is really seamless. Since we connect into your EHR, we already have the related billing information that pulls over into our system to understand the demographics and insurance information. So with the, we were talking about the capturing of that driver's license. In the case of a family, we're pairing that driver's license to the existing information that's on file for that family to go ahead and bill. In the case where the insurance is different, the mobile hub also allows the ability to take a picture of the insurance card, which would then extract all that information as well, encrypt it, and then give us the ability to bill for it on your behalf. Some more questions I'm seeing in here are specific to EHRs. Someone specifically saying, Athena, how about Athena? Are you integrated with Athena? And the answer is yes, we are fully integrated with Athena top to bottom. It's a two-way integration that takes information from your EHR, and we're able to process it. And then with the scan of that dose, all the information we capture, we actually send back into your EHR. It's a really fantastic flow. So Wanda, maybe I'll ask you just one last question that you can maybe just lean in with the group here. If you were to, to say, one thing you would challenge people to kind of lean into this moment as they evaluate both their existing pains and the new pains that have been introduced by COVID in their immunization program, why do you see now as like the pivotal time to act?
Well, thanks for the question, Joe, and thanks for all of you for your time with us today. I truly believe that we're at a watershed moment for primary care. People are realizing that we are the core of the American healthcare system, and that we've had underinvestment for too long. We've not had modern technologies. We've not had modern ways to communicate with patients. We've seen a rapid shift to telemedicine. I would put VaxCare in there as a modern way to do vaccine management in practices in primary care. It also takes a lot of the financial risk out of the way. We've all had a refrigerator that goes bad and you eat that. Well, VaxCare gets rid of that risk for you. We've got ways that we can track inventory. There's patient safety factors that are amazingly different when you can scan a dose with a device that VaxCare provides, and you make sure the right dose gets out of that inventory. We can help you with your VFC inventory tracking. There's a lot of sources here that cause difficulty to your patients, your staff, and mine that VaxCare can solve. And so this is our time. This is our time to step up and I think really show the country what primary care is made of. Thank you.
Awesome. Wanda, thank you so much for your time today. Thanks for those who participated. If you want more information about VaxCare, I'd encourage you to go to vaxcare.com. There's buttons on there that'll say learn more or schedule a demo. And then we'd love to follow up with you to provide you some more information about how the service works, how we could equip your practice with the same tools that we've gone over today. More than anything else, we hope that you stay safe and take action. But thank you for the role that you continue to play in primary care. We couldn't do this without you. A recording of this webinar will get sent to you tomorrow. So if you want to share it with other colleagues, and again, for more information, please reach out to vaxcare.com and follow up with us there, provide us your information, and we'll reach back out. Thanks again for your time today. This now concludes the end of our webinar. Have a great afternoon.